Ever pondered the significance of cold and hot therapy in sports training? Well, it's an essential aspect of an athlete's regimen, but its application varies widely across different sports. Consider endurance sports like marathon running, cycling, and swimming. Here, cold therapy often takes center stage in recovery, helping to reduce inflammation and muscle soreness after grueling long-distance events. Hot therapy, on the other hand, is typically used before training to increase blood flow and flexibility, and during recovery to alleviate muscle tightness. In team sports like soccer, basketball, and football, cold therapy is a post-game or training staple. It addresses acute injuries, reduces muscle soreness, and decreases recovery time. Hot therapy is usually part of the pre-game warm-up ritual, preparing muscles and potentially reducing injury risk. It can also help manage chronic conditions or injuries during off days. Strength and power sports such as weightlifting, shot put, and hammer throw often use heat before training sessions. This approach enhances muscle elasticity and flexibility, potentially reducing the risk of strains during high-intensity activities. Cold therapy comes into play after workouts, managing inflammation and speeding up the recovery process, particularly in areas prone to overuse injuries. In combat sports like boxing, mixed martial arts, and wrestling, cold therapy is crucial for immediate post-fight recovery and injury treatment, given the high-impact nature of these sports. Heat therapy is employed in preparation phases to improve muscle flexibility and joint mobility, as well as in rehabilitation settings. For racket sports such as tennis, badminton, and squash, cold therapy is used for acute injury management and post-match recovery, alleviating muscle and joint soreness. Heat therapy is applied before matches to prepare the body, focusing on improving flexibility and reducing stiffness, especially in the back, shoulders, and arms. Gymnastics and dance heavily prioritize heat therapy for its benefits in increasing flexibility and reducing the risk of injuries during training and performances. Cold therapy may be used more selectively for injury management or to cool down specific areas after intense practices. In gymnastics, heat therapy is often applied before stretching routines to help muscles become more pliable and less prone to strains or tears. Dancers also utilize heat therapy to improve blood circulation and enhance their range of motion. Contrastingly, cold therapy is commonly used in cases of acute injuries like sprains or bruises to reduce inflammation and numb pain. It can also be beneficial for athletes to apply ice packs on overworked muscles post-performance to prevent swelling and speed up recovery. In winter sports like skiing, snowboarding, and ice skating, heat therapy takes precedence before activities to counter the cold environment, preparing muscles and joints by increasing blood flow and flexibility. Cold therapy is used for recovery, especially considering the high incidence of acute injuries and muscle strains. Across all sports, the integration of cold and hot therapies into an athlete's routine is a finely balanced act. It often requires professional guidance to ensure efficacy and avoid potential downsides associated with incorrect timing or application. Ultimately, this balance aims to optimize athletic performance, enhance recovery, and minimize injury risks. In essence, cold and hot therapy play critical roles in sports training, each with their unique benefits and applications. Remember, what works best often depends on the sport in question, the athlete's personal needs, and the specific circumstances surrounding their training and recovery.